a dual phase case for a patient who has metastatic carcinoid. That's the carcinoid in the region of the pancreatic tail. These are arterial phase images, and just for a little tip that I have seen, it's not documented anywhere in the literature, and I'll show you examples of that. You can see that the metastatic disease in this patient is hypervascular. Along with that fact, some of the metastases show necrosis, and therefore you can have fluid levels. You can see multiple metastases here, fluid levels. So if you have a patient with an enlarged liver, multiple focal lesions with hypervascularity and a fluid level, I'm not sure if it's documented anywhere in the literature, look at the rest of the abdomen and look for a hypervascular primary carcinoid tumor. Now, the triple phase or a multi-phase protocol is basically used in all patients with cirrhosis or HCC. You can also use it for other benign focal lesions such as FNH and adenoma, where you have a non-contrast, a late hepatic arterial, and a portal venous phase. In my institution, we use about 100 ml of contrast depending on body weight. We inject at a higher rate of 3.5 to 4 ml per second. And like all scanners, we trigger with placing the Hounsfield unit over the aorta at 100 HU. The subtle difference when you're examining the liver, and this is what I meant by late arterial phase, that if you go back and look at the default value of the delay in trigger after peak attenuation is reached when you place the ROI on the aorta, you will see most scanners have a default value of between 5 and 6 seconds. If you scan the patient within 5 or 6 seconds after that 100 HU is used, you will be actually doing an angiographic phase of the study, which is an early arterial phase. And that's detrimental when you're examining the liver. You have to use the late arterial phase because you have to give both the liver and the lesion an opportunity to pick up the contrast. If you don't give the normal parenchyma the opportunity to pick up contrast, you will not get parenchymal attenuation difference between normal and abnormal parts of the liver. So this is probably the most valuable tip that I'll give you all afternoon. The delay in a case of CT for liver in the arterial phase has to be between 10 to 14 seconds.